Thank you very much, the team from Wayne University, and also don't take it for granted you giving in your time to come and educate the viewers and the communities of West Nile. And our topic of discussion today is relating to autism. And I know by the end of this session, to whoever gives in his time to listen and view this episode, you'll be able to get knowledge, understanding, and wisdom how you can live with children who are having autism, and how you can always be of help and assistance to these children. I'll go back to Mr. Otim, the faculty from Mono University. We would love to know from you, what is autism?
Yes, thank you very much for that question. Yes, and I know many communities have been probably wondering this condition. So autism, in mental health we call them autism spectrum disorders. We are saying it's a spectrum of disorders because it's a disorder that presents sometimes slightly different from each other, but there are common things that they share. And some of the things that make them qualify as autism spectrum disorders where they share in common, it's basically the impairment in the social communication and the behaviors. There is disturbance in behaviors, including some restricted interests and repetitive or stereotype behaviors. So these are common symptoms that categorize this spectrum of disorders. So basically, the challenge is the social communications and interactions are a big problem. The feelings, the imaginations, and the way these children establish relationships with their peers. So this makes it quite unique and is somehow distorted from the normal developmental stages in other children.
Then we go to Mr. Legratius.
Yes.
We would love to know from you, how common is this disease, maybe this disorder, when we go to the communities?
Yes, thank you, Mr. Tom, for the wonderful opportunity that you've given me. Maybe I could add something about autism. We know that autism is just a neurodevelopmental disorder in that it affects the brain. So if the brain is affected, it means that it shall result into a disruption in social interaction as well as the communication. So according to the World Health Organization, it is estimated that 1 in every 100 children approximately are affected with this condition. So we can see the magnitude of how big this condition can affect our society and the magnitude with which it affects children. So as we know that this condition is an early childhood condition. So when we go in the communities, we see that communities have misconceptions. As we know that communities, they always say that we have what we call witchcraft. But I want to eradicate you or to make you know that this condition, because of the misconception that the society may be having on these children, it brings about the stigma as well as social interaction is always disrupted. So we as health workers, it's our role to come back to the society and we tell you what exactly is happening to these children. Thank you, Mr. Tom.
All right. Thank you very much, Mr. Gracious. Actually, you took us through part of the misconceptions. We have seen people in the communities like attribute having a child who has such disorders, maybe in regards to communicating with their peers. Some people attribute it maybe to witchcraft.
Yes.
Some people attribute it maybe to, like we could say, maybe it could be inherited. Some have beliefs, maybe it's punishments from their gods. However, we would love to hear from Mr. Tim Douglas to clarify on whether such misconceptions could be true or they can be washed away scientifically.
Thank you very much, Dale and Junior. Yes, indeed, society perceives some of these conditions differently. And I want to tell you, every culture have their own myth and misperception. For instance, in Africa, we have very many cultures. As you highlighted, a number of them believe probably this could be witchcraft, this could be either a punishment or something that you have done previously. Others try to link them with so many other situations. But in science, all those we have not come across a clear link with all these accusations or these misconceptions. And autism actually do not have a clear cause as the community believe and perceive. Yes, there is no clear cause. However, we know genetics vulnerability contribute to some small percentage. Yes, and that contributes about 20 to 35% of those ones who develop autism. But most of them do not have identifiable or demonstrable cause. And looking at the misconceptions arising, I think we need to give the community a clear message that autism can affect anyone, irrespective of who you are, where you're coming from, but basically it occurs due to the genetic related factors within the environment that we propose probably has contributed. For instance, maybe having an exposure to toxins within the environment, but still that plays a very little role. So about 80% of the autism cases, we do not have any other link to the cause. So that's the challenge we are dealing with.
Thank you very much, Mr. Otin Douglas, faculty from Moy University, and hope the viewers have taken keynote of that this maybe disorder is not as a result of witchcraft. It's due to some factors we took up in the genetic path of it. However, again, I would love to know from you, sir. You told us genetics. A viewer may not understand when you're taking out through genetics. Is it also maybe relating to hereditary, because we hear genes, hereditary, stuff like that? We would love you also to clarify that.
Thank you so much. Thank you. Yes, when I try to bring the issue of genetics, we are looking at how gene is translated from one person to another. And when you have a gene that may have this vulnerability, what happened during the process of development from the womb, there could be some mismatch in how the genes are aligned, or how they communicate, or how they flow. As my friend noted, this is a neurodevelopmental disorder. It's a neurological disorder. So in the process of development, the genes need to be able to multiply and then increase so that you can grow and become an adult. So in an event where there is a problem in the process of how these genes are coordinated and discharge their effects, then chances are high that we may be able to see some of these mentally related conditions like autism coming up. Yes. So even we talked about the environmental impact, that sometimes like the pesticides, those toxins can contribute. This also affects the way the neurons are developed, how they're generated. So once they get interference in the process of how they multiply, then we may be able to see such kind of a child developing autism. Okay. Yes.
All right. Thank you very much, sir. Hope the viewers have gotten to understand then how you could end up having a child who has this neurological disorder, neurodevelopmental disorder, which is called autism. However, again, I come back to you, sir. You told us it's maybe gene-related. We have heard of some scenarios where maybe people in their late ages tend to produce children, and these children who are produced maybe in the later or older ages, these children have some neurological disorders. Is it also to the case of autism, in case maybe someone delays to have kids, could they also in their later ages end up having kids who have this neurological disorder?
Yes, thank you very much. In relates to the age of the mother, yes, there is a research that link the extreme age to autism. So a mother who conceives probably at a later age, sometimes she may end up having a child with this problem. The justification here has been that as we grow old, the cells or part of our genes begin to die, and this is a normal process. Yes, just like you see an elderly person may reach a stage where they cannot even conceive because some of the cells, some of the proteins that are expected to keep them healthy are now getting old, they are getting tired, and in that process either they get deformed or some of them die or their numbers decrease in size. And this gives opportunity for someone probably to be able to develop these autism disorders. So meaning we need to be very, very careful about when do we need to produce children. You need to produce when you are still quite younger, where your proteins, the genes and everything in you are actually increasing and they're still healthy, other than waiting when now you grow old and most of the things are now dying or they're also getting old. So this may deform the process of how the development takes place, especially for a baby who is still in utero or within the womb. Thank you.
Thank you very much, sir. Hope the viewers have heard the communication from an expert that if you wait to have kids in your later stages, it could affect the kids. However, not too early also to have kids. I would love also to know again from you, sir. We often hear some disorders or maybe illnesses tending to be more common in a given gender. Is also autism more common maybe in the boys or in the girls, or it's an unequal distribution in both genders?
Yes, thank you for that. Yes, there are a number of conditions that are more in specific gender distribution. Sometimes we do not have a clear reason why it happens so, but we see them in practice. In the case of autism, yes, we have seen it is very common in boys than girls. In fact, it's about 4 to 5 times in boys than in girls. So we keep asking ourselves, what could be the issue? Yes, sometimes the researcher says probably men tends to present with outward symptoms that can easily be recognized than ladies. And even if we are to identify those ladies, the girls, sometimes we identify them slightly later than the boys. Boys tend to present quite earlier, like 3 years. Someone with autism you can be able to suspect because of how they behave, because of how they communicate, because of how they relate with others. So you can be able to know there could be something wrong with this. Yes. But for a girl, you may get it from around 4 years. Yes. So that's what we see in practice.
All right. Thank you very much, sir. Hope the viewers have gotten to understand that it's more common in the boys, and also you told us of the age that you can easily identify it in the boys less than 3 years, then in the girls 3 years plus. Then also I come back to Mr. Deogracius. How can someone in the community identify or get to know maybe this, or start suspecting whether his or her child could be having this neurodevelopmental disorder which you are calling autism?
Yes, thank you, Mr. Tom, for such a good question. Yeah, we know that when we come to such a condition, which is a mental disorder, we said that we saw that there is always difficulty in communication as one of the classical signs. So when we go to the community, you see that this child is unable to sustain a conversation, okay? And also you can see, we know that language development, it starts at the age of 9 to up to 4 months, okay? So we know that by the age of 9 to 12 months, the baby should be in position to at least make a syllable or a word, okay? Like can be saying dada, you know. Then when we progress from the age of 1 to around 3 or 2, we see that this child is able to do a bisyllable word. It may not be making sense, but he may be saying, mama, go. You get it. So by the age of 4 years, we expect that this baby is able to make a meaningful sentence, okay? Like, mama, I want to go out. You get it. So if you see that the child at the age of 4 years is just making one word, mama, mama, it shows, it can give you an insight that probably this child is having autism, okay? Then another thing we can see, it could be difficulty in social interaction, okay? We see that this child is always isolated. Take for instance, we see that he's not able to associate with colleagues to play, okay? Also, we see the symbolic plays, okay, that can be made by the child. Take for instance, you know, as we are growing up, we tend to see that a child can get a stone and tries to call another colleague, okay? It can, if a child at that age is unable to do such things, it can also show you that this could be a predicament that this child is having autism, okay? Thank you, sir.
All right. Thank you very much, Mr. Degracious. Maybe, sir, Mr. Tim, could you have anything to add on before we move to the next?
Yes. He took you through basically how these children present. And what I could add on what he said, yes, autism, as we said, starts a little bit earlier, like around the age of 3 years. As I said, we have a number of behaviors that you may be able to easily see in this client. However, we should also know that not all of them may have a similar thing. They are slightly various. There are those ones who could not totally listen, could not interact. They have a deficient in communication and building and sustaining relationship. So they tend to just be in their own world. Yes, but there are those ones who try to speak. They try to communicate, but you may not be able to clearly get what they want to communicate, and they can also be able to create some relationship, though it may be challenging for them to maintain that relationship. Because most times, it's how they try to interact with their environment. That is what we are seeing in communications and their behaviors. So this is a common thing with autism. And one thing you can easily suspect your child could be having autism. You see, when they're playing, they may be playing with one thing times and again, what we call stereotype. Yes, the child likes drawing maybe the cartoon for a car, and every time, and you know, when you want them to do something else, they'll still go back to what they want to do, because they feel probably they are comfortable with that, other than trying something new. And also when a stranger or someone comes and tries to play with them, maybe touch them, they say, wait, they withdraw, and then they come, you know, they don't want to be touched. They are very sensitive. Actually, autism children are very sensitive. You touch them, you know, you have to be very careful. And you can easily see like, this child is not easy. And that's why sometimes they don't easily integrate with their peers. They don't really play. Because they feel either their peers are over disturbing them, because you are talking to them, they feel like, you know, this is very sensitive, I cannot contain this. So these are some of the things. And also there will be a delay. The moment your child delay to speak, maybe begin to make some odd sounds, making some queer kind of sound. As Deus said it, that at certain age we expect them to be able to talk. And these things build over time. So a child of 3 years should be able to interact with you. Even when you engage them, like maybe we are drinking water in a cup and we are sharing. So I take, you also take. So this one does not know this kind of interaction, like taking turns, like it is my turn to take, it is your turn to take. So these are the things that we normally realize. And the best person actually to be able to identify these are the parents, because they stay with the child longer time than another person. Yes, so such kind of clients, if you see it, you should be able to bring it to the health facility so that we can have a deeper interaction to understand what especially is going on. This could be a candidate of autism so that we can be able to guide you on how best we can help this child. Thank you.
Thank you too very much, sir. I hope the viewers have gotten to understand, in case you have your child at home maybe from the ages of, I think, 4 months, I think, to 3 years, and they have any of those presentations, maybe they aren't sure, as the team has said, please, you are advised to start suspecting this child could be having a neurodevelopmental disorder. Then I go back to you, Mr. Gracious, you could add on something briefly. In case there is in the community, there is a parent who identifies his or her daughter maybe is having such presentations, they're antisocial, maybe if they have one toy, they're playing with only that toy, they don't want to venture into learning other things. What could be the next steps for these people to take?
Okay, thank you, Mr. Tom, for such a good question. Me personally, I got an opportunity to interact with one of a child that had autism, and that was my sister's son. And the conditions were so amazing because this baby, you know, with babies, when you slap a baby, you expect this baby to cry, you know. But this baby could just do what? Laugh at you. You get it? Or even could make some weird behaviors, goes behind and then hides his head. You get it? So when you have such a baby that is having autism and is suspected that this condition is autism, first of all, you need to go to the health facility, okay? And you seek for health advice, because these patients are, the children are not easy to handle, okay, because of their behavior. And then if you come to the hospital, we can give you a guideline of how to manage such babies, okay? But if you have your child that is having any of these signs or the symptoms that we have talked about, probably we can do what we call communication therapy, okay? You can be, when you are communicating to such a child, you should be always clear and concise, okay, in your communication. Don't use idiomatic expression, okay? Even allow this child to try to process the information you're trying to give to this child, okay? So you try to give that ample time for this baby to try to reconstruct in his or her own understanding, okay? But also you can do some scheduling. You try to schedule, you make a timetable for this child, okay? Take for instance, you know, from morning to this, and then continuous making this baby to rehearse. You tell him or her every morning you are supposed to be doing this, okay? Every morning when you try to emphasize the same thing, it will, in the sense, it will start to stick in the mind, okay? But the best option could be to bring this patient to the health facility and you'll be given the guideline. Yes, thank you, sir.
Thank you too very much, Mr. Gracious. I hope our viewers who gave in their time, you are seeing how useful and you are getting like equipped with more knowledge in case you happen to encounter a child who has autism or maybe this neurodevelopmental disorder, on the steps you could do. However, we're going to first break off for a short commercial break, and we'll be back in the next segment where the team and the faculty from Moon University will take us through like the medical management, more of the medical management, which they always do in case your child has these neurodevelopmental disorders, and also the various therapies they could give to your child. Thank you. Let's get back.
West Nile TV, lighting up the region.
out for StarTimes Solar to unwrap your lighting and entertainment experience this Christmas.
We wish you a Merry Christmas.
At only 700 shillings daily charge, get yourself a StarTimes S50 that comes with lighting, phone charging, strong lithium battery, radio with a flash port and a Bluetooth speaker. For more entertainment needs, get yourself a StarTimes S130 that comes with an extra 32-inch TV screen and 2 years free StarTimes subscription. StarTimes Solar, more than just solar.
Echichi go wangula nsasula emyezi 3 nempangula. Hey ha
abayo ubatachi
Subscribe for 3 months to any package of your choice or grab an Azam TV kit and pay for 3 months and stand a chance to win life-changing rewards. Android smart TVs, fridges, motorcycles, and that is not all. You could walk away with free subscription or the grand prize of 20 million Ugandan shillings in cash. Yes, 20 million grand prize. Subscribe today and enter the draw. For more information, 031 2308 900 or visit any Azam TV dealer near you.
Azam TV, entertainment for everybody.
West Nile TV, lighting up the region.
We'll be back, dear viewers, from that short commercial break. It's still your health program here at West Nile TV every Thursday from the hour of 11 a.m. to noon, and I'm always your host, Sandy Junior Tom. Today we were delighted to be joined by a team from one university. We have a faculty who is Mr. Tim Douglas and also Mr. Deogratius, who joined in to come and educate you, our viewers, matters regarding autism, which they told us that it's a neurodevelopmental disorder which children always face in their young stages of development. However, Mr. Deogratius took us through a brief of a step on what they always do for these children in case they have autism, and we would love the faculty, who is Mr. Tim Douglas, to pick on and tell us of more they always do in case the child presents with autism.
Thank you, Junior. As Deus has already alluded on some of them, yes. To begin with, there's some things he mentioned from his experience. He had been close to a child, and he was wondering when they slap the child. Instead, they expect the child to cry, but instead this child just laugh and do funny things. One thing that I want the listener to get it clear, as we said, autism presents slightly differently. As he said, sometimes they don't respond even when slapped. These children are insensitive to pain, to heat, and taste. So sometimes they don't feel the pain, just like a normal person. So you can slap them or something can happen, and you don't see them crying, and you really wonder what exactly is going on. Because we say this is a neurodevelopmental disorders, it means some of the development that should have occurred within the system to help him coordinate with the outer world, it's either lacking or it is not properly developed. So you will even realize that this child, when they're eating food, they have preferred food because their tastes are also quite specific, just like their taste. Sometimes they don't feel the heat. Just to get back to some of the management he talked about, yes, there's a range of management that we have to employ for this child. As we said, the problem with this child is socialization and not able to communicate and having those behaviors that may not be quite accepted within the community. So the focus should be to help this person live with the disease. In other words, autism has no cure. So we just try to do our best to ensure this person live and continue and also become independent in life. So one thing that we focus on is the medications. The medications we give is not to cure, but there are approved medications that we can give them in case they have those behavioral symptoms which may challenge those ones that stay with them, and also they can sometimes become aggressive, so we give them the medications. So a number of medications that have been approved, but these medications you get it from the hospital, meaning for you to be able to access, you need to go to the hospital, then we do a proper screening, whether your child have autism, and then we also have to classify the level of autism, whether this one can need medications or we need other support. So we do that. We have a range of medications. I may not be able to say it here, but when you reach the hospital, you can be able to get a variety of them, depending on how your child presents. And we have speech therapy. As we know, their biggest problem is communication. So we try to teach the caretakers and this child on how they can be able to communicate. As my friend has said, when you're giving them instruction, you're talking to them, you need them to learn the body language. You need them to get clear and short sentences so that they can pick something small. Because if you are talking to this child and then probably you give a very long sentence, they will get lost totally. So you need to be clear. Maybe water, and as you teach them, you demonstrate. Either you show the picture. Maybe you are talking of water, you can carry a cup. You are teaching them, this is water, I'm taking water and you are demonstrating so that they get to learn. Yes, sometimes we use a lot of pictures to help them learn, and these people can pick up. The only thing, we don't need to rush them. We just go slow. We say it is a developmental issues, meaning their development has been slowed down. So we need to introduce things gradually and then help them slowly. Even when you introduce something, maybe an object, bring one at a time. Don't bring so many things and you expect them to be able to know. You can bring one thing, this is a phone, you demonstrate for calling, and then you bring the book, this is for writing. Yes, we know there are children with autism that sometimes pick up, although their learning may be a little bit slow, but they can be able to learn and be independent. Yes, it's a gradual process. So we have that, and then we have other therapies that can be given within the hospital setting, like behavioral therapy. Behavioral therapy, we try to reward them on each behavior they display. If they display good behavior, we give some positive reward so that they can maintain that behavior. And if they do something very strange or behavior that is probably negative, you try to do something to punish them, like, when you do this, maybe I don't give you food, so that they know, when I do this. So we just try to give them reward to support them so that we promote those good behaviors. Yes, the speech therapy and all that. The most important thing here is early identification. We need to identify them early so that we can start these interventions we are talking about early. If you wait and then you start later, it will be very difficult because this is already grown up, maybe very rebellious. You want to talk to them, they don't even want to talk to you, even the mother. So we need to identify them early, based on the clear signs that we have said, so that we can be able to start early. And once you get the patient there in the field or you have a client, please do not take this person to the witchcraft, because we know in Africa, people try to, by the time they come to the hospital, they have tried so many things. Yes, you may be intoxicating this, you go to a witch doctor, you take this thing, by the time you come here, probably this child has developed complications. Or else, this child may even think, because whatever they are getting from the other side, they see it as a punishment. You bring them to the hospital, they become very hostile, because they know they will be subject to the same things they have been going through. So bring them early so that we guide you, we sit with your child, we take you through how you can be able to help this child, especially on the issue of behaviors, the issue of communication. Yes, thank you.
All right, thank you too very much, Mr. Tim Douglas. Hopefully viewers have gotten to understand on how you could live with a child who has this neurodevelopmental disorder, the management in which they always do in the hospital. And key point I noted out it, please, since many people attribute such a condition to witchcraft, so they tend also to take the kid to these witch doctors. He told us that's not advisable. Instead, you'll be intoxicating your child. Then I get back to Mr. Delgracious.
Yes.
In case, would they have identified the child and they have initiated this child on these various therapies and medications, how can the community or the parents outside there viewing us live with such children who have this neurodevelopmental disorder?
Yes, first of all, I want to tell you, our viewers, is first, accept these people the way they are. They have what we call social isolation. So in the first place, accept them the way they are and try as much as possible to support them, because it is very important. And one thing I can tell you is everyone matters in this world. One thing I can tell is that we have seen people who have autism and they have slight. Take for instance, historically we know a man called Albert Einstein, one of the greatest physicians as well as a mathematician. He was diagnosed with autism, but because of support and early detection, as our dear lecturer said about it, it gives you an insight, okay? If you detect early the condition, you support the patient, okay? And also, if you see that it's trying to deviate, it's always important to make a follow-up, or you call the doctor, okay? Thank you so much.
All right, thank you very much, Mr. Delgracious. I get back to Mr. T. Also, Mr. Degrasha hinted about it, about early diagnosis or maybe early interventions identifying a child who has this neurodevelopmental disorder. We would love to know from you, in case the community or maybe the parents that say that they remain reluctant, they identify the signs and symptoms that this child could be having autism, but they remain reluctant on taking this child to the hospital for specialized management. What could result, or maybe what could be those shortcomings which are dangerous to both the child and also the parents?
Yes, thank you very much. Yes, we are emphasizing these children need to be recognized early and also supported along the way so that they grow. So in an event where probably we don't take it serious and then this child remains with us in the community, this child is going to grow. And as they grow, those behaviors they have will remain in them. Instead, actually, they strengthen those behaviors. If they have not been talking, maybe they become hostile, you know. The challenge now will be the community will even start to isolate the client and isolate the whole family because they think this person is having mental problem. You know, I cannot relate with these people, you know. Every time people feel they are not secured. But if you come to the facility, then we guide you on what exactly you need to do with this child, and then we monitor this child. Chances are that this child can be able to live better, as we say. So leaving this child there, you will be allowing this child to remain with those abnormal behaviors, and also these children are prone to get other mental related conditions can come in, especially when they become very hostile. In terms of their behaviors, because they are not trained, meaning they're going to cause more problems. Even to you, they will become very aggressive and start fighting the family members, and that will be too late. So we don't want such an event to happen. So you should be able to identify these people early, and then you bring them to the hospital at earliest possible time, because we have opportunity to guide you, to work with you, and to follow them up until they're able to probably stay without you. And remember one thing, if you don't bring them to the hospital, most times you have to remain at home and taking care of them. Now imagine you have an 18-year-old or a 12-year-old and everything you're doing for them because we have not trained them. Don't you think you need to go out to work, to look for money, to go to the market and do other things? So you need to train this person to be independent. So meaning, in the long run, you can also have economic issues at home because most times you spend taking care of this because you know when it goes outside, it's going to cause problems with the neighbor. So most times you are there. Or else now you start tying this person with a chain, and that is what we don't want. When it reaches that level, that would now be totally something different. And we want everyone to be able to access healthcare services. That's the point we're emphasizing here. Thank you.
All right. Thank you to Mr. Tim Douglas. However, again, I'd love to know from you. At one point, you said this neurodevelopmental disorder can't be cured. Is there a possibility, in case maybe after proper management and training of these children through these therapies, could this child be able to become independent in life as they are aging?
True. And that is the goal of treatment we are talking about here. We want them to be independent so that you are free to do your work. Yes. So they can be independent, they can be trained, especially when they now know how to communicate, how to relate, how to create a relationship, and how to sustain that relationship. Meaning, if I know how to communicate, I'm hungry, I will come and like, please, I need something to eat. And I eat, and I'm fine. It's time for bathing, I will go and bathe. And that's you as a caretaker, you will just be supervising to ensure it's moving on well. There are no any other symptoms that are coming in. Yes, even when they have other physical illness, they can be able to communicate. I have headache. Because we want him to communicate, we want him to be friend to anyone, to be able to share, I have this problem. But once we don't handle them early, and then they grow there, as I said, it becomes very difficult. Even when they are hungry now, you begin to assume, or they begin to display some aggressive behaviors, because they will not tell you, I'm hungry. But they are communicating. You know, they communicate through emotions, through so many things. So we want them to learn these emotions, and so that they can understand. When you see them behaving like this, you know he needs this, and also you can be able to do that to communicate what they need. Yes, thank you so much. However, we cannot cure it, but we just try to minimize those abnormal behaviors and help them learn some good behaviors to allow them fit in the society.
All right. Thank you very much, sir, for that clearness. And hope the viewers have gotten to understand. Please, these trainings and the therapies can help the child to become more independent, though it can't be cured. Then also I'd love to get to Mr. Gracious.
Yes.
You have told us how autism comes about. And I feel like the community also is already, the viewers are also worried. How could they prevent the occurrence of them having children who have autism?
Yes, as we said that the exact cause of autism is not known, but it is just a predisposition of both genetic and environmental factors. So we aim at mitigating the environmental as well as the genetic factors. In the health facility, we could do what we call genetic counseling, okay? We can sit down the partners and we speak to them. Okay, so if we see that in your family or your lineage there was a family history of autism, okay, we sit down and we counsel the couple, okay, and then secondly, as we said, it is environmental, okay, and this can happen during the prenatal stage when you are pregnant, okay. So we see that if a mother is exposed to toxins when is pregnant, she's pregnant, it predisposes him or her to get autism, okay, for the child to get autism. So we try to prevent getting or avoiding toxins, okay, but also improving the what? Your lifestyle. For instance, you take a balanced diet, you do regular exercise as a mother, okay, but also you could come for regular checkups. For instance, when you are pregnant, you have what you call antenatal visits. You are always given folic acid, okay? This could also prevent these neurodevelopmental defects, okay? Thank you so much.
All right. Thank you to Mr. Gracious. Maybe Mr. Tim Douglas, in case you have anything to add on.
Yes, thank you. When it comes to the prevention, we can look at all levels of prevention. Yes, we had already alluded on some of them. For instance, the issue of our eating, the way you eat, you try to avoid exposure to toxins, to things that may interfere with development when the baby is still in utero or when the baby is still in the womb. Yes, we have to take that into account, but also as we, the reproductive age, we need to produce when we are still young. When you reach now 40, especially for ladies, the cells have begun to a little bit die and deform and get changes. So this may affect probably the kind of a child you will produce. Not only autism, but also may affect in terms of other conditions that are really genetically related. So we need to take that into consideration. And yes, as he said, when you intend to get pregnant, you should visit the health facility so that they can take you through some of the things that you need to do and some of the things that you don't need to do. For instance, someone who is pregnant, we don't encourage them to take like alcohol, things that can easily interfere with the development of the fetus. Yes, that is the first stage. But also now, in case such things happen, yes, we can do the screening, as he said, but not all institutions or all countries are able to afford this. Like in Uganda, we are not yet in position to do the screening, yes, because we probably don't have well-organized facilities to offer that, so making us to miss them. So, but in other developed countries, they're able to do some of this screening, like US, like Sweden, and all that. So our focus here is early screening, probably when the child is now trying to present with that. In case we fail to have a good pregnancy throughout and so forth, then we can now wait and then screen them early. In Uganda, there is no clear agreed screening tool And when should this screening be done? It's still a challenge. However, like every institution, they're able to screen depending on their capacity. If you have a psychiatrist with the tools, they can be able to do that. Yes, but of course, other facilities, lower facilities may not be able to afford this. Meaning, it is not yet standardized, unlike in other countries. I can give you an example, like in Sweden, every child around 4 years is mandatory to undergo autism screening. It is mandatory and you cannot bypass that because they have a clear record. They know if you ask them how many clients do you have with autism in this country, they will tell you. But in Uganda, we are still struggling. And in most cases, we even don't know like how many clients with autism are there in the community. It's only when they come, that's when we can be able to identify them. Sometimes we identify these clients when they come in children's ward because they have malaria, they have other things. Then now when health workers interact with them, they see the child is not responding and then like, what is the problem? Then maybe they will advise, okay, you take them to mental health unit so that they can evaluate what exactly is going on with the child. So that is now where we really focus on in our setting here. We normally screen them when they are really like 3 years, they are, you know, because we expect them at that time to be doing certain things and they may be missing. So this basically about the prevention strategies that we have in place. Yes.
All right. Thank you very much, sir. Hope the viewers have gotten to understand more of what is always done in case the child has autism. Then we get back to you, Mr. Degracious. You could give in your key message as we come to the conclusion of our session.
Yes, thank you, Mr. Tom, for the opportunity. Yes, we want to thank you as West Nile TV for giving us an opportunity to come and we educate the society outside there about this condition. As you say that this condition, the exact cause is not known, but a combination of genetic and environmental factors. It has no cure, but also we've seen some misconceptions in the community where they say that it is as a result of witchcraft, the vaccines they give to our children, you see. But there is no research that has been linked to vaccines and autism, okay?
Life, do not deny them access to healthcare. We have seen a lot of inequalities, especially these people with disability. Please, the facilities are there for them, the staff are there for them. Please bring them over and do not take a lot of words and you know, those perceptions in the community like maybe your neighbors bewitched you. And I know outside there could be people who are now fighting themselves because they know I have never produced a child like this must be my neighbor. Or you have conflicts on some other thing, then you try to link that. No, you're blaming your neighbor for nothing. Bring the child here, we can be able to.
University, me what also I noted most, that these children can be trained and become independent in life. I've been your host, Sunday Junior Tom. We are grateful to the staff of Moon University and also the faculties. Grateful to Mr. Tim Douglas, grateful to you, Mr. Degracious. Till we meet again next week on Thursday from 11 a.m. to noon. Thank you. Catch up.